Much for that enlightening information. Next, we have up Rhea Houston.
My name is Grady Houston, and this is my project. So my topic was healthcare access disparities between rural and urban areas impacts on patient health outcomes. So beginning with my introduction, this research project focuses on the limited access of healthcare and its impact on urban and rural areas. In the United States, there is a large shortage of publicly funded health professionals due to quotas and professionals moving to urban and international locations. Rural areas also face challenges like limited public transportation and internet services. These effects can be seen in Metro Atlanta with the closure of Wellesley Atlanta Medical Center in 2022. This strained local hospitals like Grady Hospital itself and Emory's emergency department, seeing an increased patient volume due to AMC's closure. So my research question was, how do disparities in healthcare access between rural and urban areas affect emergency room utilization and overall health outcomes among patients? And when I say overall health outcomes, I mean how are their quality of life, and if they do come across illnesses, how are their recovery rates? And so my hypothesis was disparities in healthcare access between rural and urban areas lead to higher emergency room utilization and poor overall health outcomes among patients in rural areas compared to urban areas. For my methodology, I used literary reviews to collect data from previous experiences and observations. So the data. So firstly, there are two main reasons for the shortages. Medical professionals leaving to work in more attractive areas, such as urban areas. And in 2013 to 2015, 34% of urban adults utilized the emergency room for care compared to 43.5% of rural adults who used the ER. Rural emergency department visits rates increased by more than 50% from 36.5% to 64.5% per 100%, outpacing urban emergency department visit rates, which increased from 40.2% to 42.8% per 100%. Rural emergency department use also increased for those aged 18 to 64, specifically Black patients, Medicare beneficiaries, and patients without insurance. Cancer patients requiring radiation treatment travel around 40.8 miles on average from rural areas, in contrast to those who travel around 15.4 miles on average from urban areas. And so this data right here is from the CDC itself, and this shows that on average from 1999 to 2019, overall mortality rates per 100 persons has decreased steadily, but urban has a lower rate compared to rural. And on the right, you see that the causes of death are also steadily increased for rural in comparison to urban. And this includes heart disease, cancer, and all of these listed. In conclusion, rural adults are more likely to use emergency room access for primary care, indicating a shortage of local health care providers. Poor health care access in rural areas leads to poor recovery rates due to delayed interventions. And in 2014, rural areas had a mortality rate of 830.5 persons per 100 people compared to 704.3 persons per 100,000 people in urban areas. This study has also shown that Black populations have the highest mortality rates across race and ethnicity and rurality combinations for cardiovascular disease, cancer, and stroke. Unintentional deaths were highest among rural American Indian and Alaska Native residents, while chronic lower respiratory rates disease was highest among rural white residents. These findings highlight the variations in rural-urban mortality disparities across different causes of death and race ethnicity from 2013 to 2017.